Okay. Hey everyone, this is my mom who is a pediatrician at Centera Pediatrics at Princess Anne, and we're going to ask her a few questions today. So the first question is, when do you use experiments in the medical field?
So I use the results of experiments almost every day when I'm practicing medicine. So for example, just about any antibiotic or medication that I might prescribe is because of numerous tests and studies that were done on it to make sure that it was efficacious, meaning that it works well with limited side effects. And the way that the researchers and scientists and physicians go about this process is that they construct a study in such a way that it's double-blinded, meaning that the person taking the medication might receive the actual medication or placebo, and then the person that's looking at the effects that they're studying, whether it's the how well it works or any side effect parameters, that person also doesn't know whether the patient received the medication or placebo. And by doing it that way, it helps to eliminate any bias. And then they also try to get research populations with similar traits and characteristics, so that helps to also eliminate confounding variables and other factors. So for example, when I prescribe amoxicillin, I know the dosing range that works for the majority of the population, and it's reliable, and we know that people aren't going to get terrible side effects from it, and that it usually treats the condition that I'm prescribing it for. So I would say daily I use the results of experiments.
All right. Didn't you say there was a less formal way that you use experiments as well?
Yeah, so we as practitioners have to come up and experiment with different ways to get the best information and exam from our patients each day. And it comes, daily, and then over days and weeks and years of practicing medicine to come up with the best way to get, for example, an ear exam from a child. Little kids especially are fearful and cry a lot, and so you sometimes have to play games with them with the otoscope. You experiment with different ways to distract them, or different ways that their parents might hold them, so that you can get your best exam. And it's not just with ears, but hearts and lungs and everything else. So you're constantly experimenting and refining and finding what works best for you. But it's not a formal experiment, but I do feel like I'm experimenting all day.
All right, that's great. Okay, so the second question we have is, to what extent do you think experimentation is a reliable method in gaining knowledge about human health?
I think all in all, it's a very reliable way. When all of these studies are done on medications, or normal levels of potassium or chloride or thyroid hormone in your body, they study large populations, and they see this is the range where most people these levels lie. Now, are there a few outliers outside of that bell curve where this thyroid level might be fine for you, but for them they're feeling weak and tired? So it's not perfect, but I think all in all, it's the best that we have, and for the most part it seems to be doing a good job.
All right. Well, we want to thank my mom for her time, for answering our questions to help us in our presentation. So thanks for your time.
You're welcome. Good luck.